You may have noticed more people around you coughing or sneezing. Hospitals notice that as well. And tomorrow they're going to start restricting who can come in to try to prevent the spread of flu. Channel 9's BLAINE spoke to doctors at ATRIUM today, worried about the peak of flu season hitting earlier this year. BLAINE?
The hospitals with our largest healthcare providers, including Atrium here behind me in Dilworth, have a good reason to be concerned with how much the flu is spreading. And I want to bring something into view. I've got the computer out here and a map from the CDC, an interactive map showing the flu virus spreading around the United States since the beginning of the season, sometime around October. And watch as I move the timeline. You'll see most of the United States in white. And as we move this, those yellow states, that's local activity. Orange states is regional. Eventually, the entire U.S. just about brown. That is widespread flu activity. Only a few states where you would be at a reduced risk of getting the flu, places like North Dakota and Kansas. Many may say it's that time of year again. The season of coughing, sneezing, and sore throats. But the flu season is enough of a concern. Atrium, Novant, and Caramount Health are all taking action.
I would say we're being extra vigilant because it is earlier, because we are higher than we traditionally see at this time of year.
Starting tomorrow, hospitals across our area won't allow many children in as visitors.
So as of 7 a.m., children 12 and under are asked not to visit any inpatient units at any of our hospitals.
It's a tough but necessary call, and doctors are also saying it's not too late to get the flu shot. SUJIT, a busy dad who works at UNC Charlotte, says his family got the flu shot last month.
I can't think of a year where we didn't get the flu shot, to be honest with you.
This is a photo he shared of his two kids. His daughter looks less than thrilled after being teased by her dad joke-loving father. All jokes aside, he swears by the flu shot.
There's that piece about being a good citizen. And also, if you do catch it, even after you've had the flu shot, it won't be as severe.
Dr. Katie Passaretti says they've seen an 8 to 10% increase in emergency room patients with flu-like symptoms, which prompted visitor restrictions. She says it may likely get worse.
You know, the flu season is unpredictable every year. There's no way to know exactly what's going to happen over the next couple of months.
And if you look at state health data, the kind of flu activity we're seeing right now is the kind of flu activity we saw at the beginning of February last year, and that was the peak season last flu season. We've had about 10 deaths in North Carolina so far this flu season, which is close to what we had about this point last season. Scott.
All right, BLAINE, thanks very much. And you know, health officials told us it's still too early in this season to know exactly how effective this year's flu shot will be.